something slightly differently. I'm actually going to do a reaction video. It's not really a reaction because I'm going to be actually teaching. So we're going to watch a episode of, or part of an episode called Royal Pains. I actually really enjoyed them. I enjoyed the acting and the conversation. That was pretty cool. So I thought we would watch one together. I obviously cut out all the boring bits. I have my coffee, and I'm really into like Lint. I'd rather have 90% or 99% rather, but hard to come by. So let's get into it.
Divya, you're right. That champagne did not help at all.
Sit down. The fresh air will help.
Ow! Ugh, what the hell? I hate this friggin' boat. I swear.
No, don't touch that! Don't touch that!
Whatever!
Don't touch that!
Kylie, don't touch him.
You all right, man? Hey.
Kylie, call 911.
They'll call the feds. Gary will kill me. Maybe we should call him. He'll take care of it.
We need the Coast Guard. We need...
This is very common when we're actually on scene and there's a first aider or someone on scene who thinks they know what we need to do. Just let us do it.
You're gonna be fine. Go get my bag.
Oh, yeah.
Okay, the fall broke your ribs. A segment of your chest detached from the rest of your chest wall. It's called a flail chest.
That sucks. I mean, it could be worse, all right? Why is he breathing backwards?
Backwards and breathing backwards?
Paradoxically.
What, he's breathing ironically? What?
Flail segment of your chest is moving in the opposite direction of the rest of your chest.
What's happening here is that he has a flail chest. So a flail chest is defined as 2 or more ribs broken in 2 or more places. The flail chest is when he breathes in, the rib segment pulls into his ribs, and when he breathes out, his rib segment pushes out of his ribs. So extremely painful. Definitely happens.
Breathe forwards, make me breathe
We're
forwards.
gonna do everything we can, okay? You'll be just fine.
His chest is going in and out. It's going in and... It's like... What happened, Divya? Okay, he said that there was a scrambler or something, and then he just passed out.
He has a tension pneumothorax. Okay, come help me.
No, I'm trying to get us found. I prefer this job to one involving blood.
What does that mean?
His lung has collapsed, and I need to relieve the pressure, or it'll stop blood flow to the heart.
Okay,
So a tension pneumothorax is when the lung starts to collapse, and so they can't actually move any air into the lung, but because only one lung because one lung collapses, this lung then and the heart and the mediastinum actually starts to get pushed smaller, and the heart starts to get pushed. So your blood vessels are like kinked, like a hose pipe. So your blood pressure drops and the person can't breathe. It generally takes a very long time, or takes much longer than that, for someone to tension without any sort of like mechanical ventilation, because when we inhale ourselves, it's very hard to create that kind of pressure in the space where the tension pneumo is happening, in the pleural space. So that's a bit dramatized. And you're also going to see the patient would be a lot more short of breath, and she also didn't do anything to assess whether there was a tension. So we can listen to the lungs, we can assess their rate of breathing, all these other things that we can do to assess if they're actually having a tension pneumo.
His lung is collapsed, she said. Oh my God.
I'm sorry about that. Welcome back. Okay, Kylie, cut one of the fingers on this, okay? Then cut the tip off.
And I think she just used some sort of needle that's maybe like 3 centimeters or an inch big. That is nowhere near big enough. She also didn't look at a landmark. And they're not going to go from dead to awake.
All right, so it makes a tube shape.
This isn't worth the love.
Kylie, I am trying to inflate his lung. Just do it.
You have to do it, Kylie.
This is a sign. I knew there was a reason why we weren't making it to the big ship. I should end it with Gary.
Yeah, you should end it with Gary. No, there's just a situation here. It's hard to explain. She's using KY jelly on a rubber glove, and I'm not a medical guy. I don't know. She.
So that's not how that works. We used to put a one-way valve onto the needle that goes into the chest so that air wouldn't go back into the chest. But that's not actually proven to work or make any difference. So when she put the needle through the chest, it would have relieved the pressure if there was pressure. We don't put a valve on. You can use a gloved, well, you used to use a gloved finger, or could use a gloved finger. So you'd cut off the finger of the glove, and then you'd put the needle through the bottom of the finger so that it was like a one-way valve. But because the pressure is greater inside the chest than outside the chest, pressure moves out of the chest. It doesn't move back into the chest. So that wouldn't have caused a improvement in the patient's condition, and it wouldn't have made a difference. And the KY jelly, I don't understand.
I just heard a hiss. Hold on a sec. That inflated his lung?
For now. Okay, how long before the Coast Guard gets
She
here?
wants to know how long. They're working on it. Thank you.
I can't wait. I need to stabilize his chest wall before he damages his lungs further or becomes hypoxic. We need to stabilize his chest wall, but I don't exactly have a positive end expiratory pressure machine on board.
A positive end expiratory pressure machine is a ventilator. And it's not a machine, it's a setting on the ventilator. So what she needs is a ventilator, or you can actually do this on a BVM. If a BVM has a PEEP valve, you could also do exactly what she's talking about. So it's kind of misconstrued because it's not a positive end expiratory pressure machine. And for short, it's called PEEP. So I don't know, not quite the right wording.
She has an elastic band. I just heard a hiss. Hold on a sec. That inflated his lung?
For now. Okay, how long before the Coast Guard gets
She
here?
wants to know how long. They're working on it. Thank you.
I can't wait. I need to...
I'll get it all. Screw Gary.
Hank, this is Kylie.
Hi. I'm the disgruntled mistress.
Hello, nice to meet you.
It's because I didn't go to college and I hate retail.
Alcohol, go get it.
Right.
Hey there, I'm Hank.
So something by this point in time, he'd be in so much pain. A flail segment is extremely painful because you have these ribs are rubbing against each other, and it's extremely painful. Would have given him something for pain.
I'm gonna grab his legs.
Okay.
On three, 1, 2, 3.
5 minutes.
Oh my God. Okay. It's gonna be okay, man.
Let's go.
See?
Yeah, I got you.
Okay.
Divya, grab the biggest hooks you can find.
Oh my God. Okay. Oh.
Okay, here we go. Insert the...
So they just moved him so that they can pull his flail chest segment or something. We'll see what they do. And one thing is that they're not really looking at his neck. He got hit quite hard by something, so he could very well have neck pain or damage to his spinal column or his C-spine. So moving him like that doesn't really make any sense. It could have damaged his neck. They didn't even assess his neck or hold his neck still at all. And even if he had no problem with his neck, he would be able to probably walk. He would be in pain, but he could walk. But he also had a tension pneumothorax, so definitely wouldn't have carried him like that either. Would have put him on a board and moved him if we really needed to.
Nice and steady.
Okay, what? Are you sure that's the right spot? Like, how do you know?
Evan, you're not helping.
Just pressure too. That would really help.
Evan, focus.
Yep. Okay. Oh my God.
So fish hooks are obviously unsterile and have a lot of other issues with putting them in and taking them out. Obviously, you've heard of like fish hook removal techniques and sort of things like that. So this doesn't make sense. And then also there are underneath every rib is a complex of nerves, arteries, and veins. And so these would be puncturing a whole bunch of like vessels, causing a whole bunch more damage to like nerves. You're going to puncture the lung again. You now have 3 holes in your lungs, or 4 holes in your lungs.
Good. Follow the curve of the hook.
It's coming. It's coming.
Good. All right, Evan.
Hank, I'm attaching the hooks to the lines.
Okay, great. Run them through the pulley and attach the weights to the other side. Good. Good. Now, let them go.
Oh my God, it's working.
Okay.
Ew.
I'm gonna take a nap. Throw up.
I'm glad it ended there. But so at the end, you saw how the hook thing like pulled the ribs away. We used to say that we can apply like a pressure dressing or a pressure bandage to the broken ribs to try and stop them from moving. So you could like apply pressure to the flail chest, and that would hopefully stop the movement of the ribs. but it didn't really work. So really, like, it might decrease some movement of the ribs, but it's not going to take it away at all. The patient will not breathe. So I actually pulled an intercostal muscle like quite a while ago, and I struggled to inhale properly because it's so painful that you stop breathing in. If your ribs are broken, you're also going to start breathing less. And so when you start breathing less, you then have an increase in your carbon dioxide in your blood. So you become hypercapnic, so high levels of carbon dioxide. And then they're going to start to feel really ill and try breathe more, and they're going to get into quite a bad place. So that's why intubating these patients, putting them on a ventilator or a BVM with a PEEP valve, you can paralyze them, you can give them pain meds, you can sedate them, and then in theater, they'll then tie all these things together. So guys, I hope that was at least educational of somewhat. If you want me to do this again, I'd love to know in the comments. I'm not sure if it fits my channel mood or the way I want to do things, but I asked if people wanted me to do this, and a lot of you guys did, so